Well, welcome back to the Navigating Your Life show. We're now joined in studio by Dr. Michael Rowland of Oral Dynamics in Allentown. So welcome, Doc.
Hello.
Thanks so much for being with us.
You're quite welcome.
Good. So, Doc, you're going to talk with us about some of the advances that have been made in dentistry. So would you please tell us, you said that you've had 32 years of experience in dentistry. So tell us what you've seen during that time, but more importantly, what's been going on lately.
Well, one of the big things that's going on presently is the conversion of our radiographic systems to digital. This has several benefits. For us, it's much more immediate. We get the results.
So, Doc, when you say radiographic, you mean the X-rays?
X-rays,
okay.
Correct. When we take X-rays now digitally, we get the results on a monitor within seconds. We do not have to wait to go to the old darkroom.
Wow.
In fact, my new office doesn't even have a darkroom anymore.
And Doc, what you mean by that is that lots of times when I've gone to the dentist takes the picture, puts it right into your file, and looks at it and then files it away in the file, and all that stuff is being done in real time, where before you'd have to wait for stuff to be done, but X-rays can be looked at and...
That's correct.
Wow.
You immediately see the results. If need be, you get to retake it and with very little time lost.
Sure.
The big benefit for the patient is the reduction in the amount of radiation they get, and that's a concern for everybody.
Oh, sure.
So digitally, we're getting maybe 10% of the radiation that we used to get on films.
Wow. All right. And so what is that X-ray telling you, other than being able to get it, getting it more quickly in a time frame? Is it the depth or the ability to see stuff? Is it a different kind of X-ray now than it was before?
It looks very much the same.
Okay.
We're currently into the second generation, and the quality is excellent. I'm really impressed with the strides that they've made.
Good.
Along with that, the latest that's coming along is cone beam 3D scans. These show the third dimension in radiographs and X-rays, and allows us to visualize the jaw in ways that we have never been able to do before. What we're seeing here on the screen is a depiction of a gentleman's lower jaw.
Okay.
And I have been able to trace the nerves that run through the jaw.
Wow.
And I can see where I have sufficient bone to place implants. And so we do this all on the computer. And when we go to the patient for the surgery, we know exactly where those implants need to go.
Wow.
We can even make surgical guides from these depictions that will help us do the surgery more quickly, with more precision, less trauma to the patient for doing the work.
Good. And let's put up the other picture on screen that you have. And this is a picture of, I guess, a person's jaw.
Again, it's a person's jaw, upper and lower jaw, that she was missing a single tooth here. With the program from the cone beam scan, I placed the implant in the virtual setting here.
Okay. So this allows you to dream as a dentist before you start doing stuff. You can see what it's going to look like potentially.
We know exactly what it's going to look like. We know, first of all, whether there's enough bone there, because we can see all the dimensions. We also can see what the quality of bone is. The coloration down here shows us whether the bone is solid and how good we expect the implant to take.
Sure.
From this representation, I was able to have the laboratory make a model.
Wow.
And
so from that digital picture.
From that digital picture and another digital picture of the patient's teeth, we sent them the information. They made a model.
Wow.
And there's a surgical guide here. And the surgical guide will fit over the teeth.
Wow. And we'll show this on camera as well. But it almost has like a hole where you put this on top of the person's tooth.
You put that on top of the person's teeth.
Doc, I'm starting to feel that I could be a dentist with this kind of format here. I could just, because the hole is right there.
The hole is right there.
Wow.
You have the direction. You know where it's going to go.
Wow.
It doesn't.
Wow.
It isn't rocket science anymore.
Wow. But I would want to warn our listeners, if you see me doing dentistry, I would clearly stay away. I think you want to stay with Dr. Rowland for sure. But wow, that's really setting a person up for success right coming in the door, and the risk of making mistakes and
vastly reduced.
Wow.
I mean, it really does make the whole process simpler.
Wow.
Not only for us, but the
Sure.
benefit for the
Sure,
patient as
sure.
well.
And I see you have another device there, Doc. Why don't you share with us what that depicts?
Well, one of the newest things that we have is Invisalign.
Okay.
It's an alternative to traditional braces where you have brackets and wires.
Okay.
The theory here is that we have a series of small plastic trays
Okay.
that fit over the teeth, and the gentle pressure that these trays place on the teeth allow us to move the teeth into the desired position.
Now, do these change over time, Doc? Do they keep getting tighter and tighter or moving back more and more?
Well, there's a series of them.
Okay.
So we may have a patient that will get, say, a dozen of these, and each one moves the teeth just a little bit.
Okay.
And so, like traditional braces, they put a little bit of force on it, and when you've utilized all that force, then you go to the next set of trays, which gives it a little more force, until you finally move these teeth into the proper position.
And Doc, this as the length of time using Invisalign versus the braces, is it in retracting the teeth?
I think it's pretty comparable.
Okay.
We're using the same forces, just the different mechanism for generating those forces.
Wow.
And it's really a boon for adults who do not want to,
Look
show
obvious,
the teeth
sure.
with brackets on. Yeah.
Wow.
And very, very popular with them.
Good. Well, Doc, we're getting ready to wrap up. Is there anything else that you want to highlight about some advances in dentistry?
I think overall, one of the biggest things has been the cosmetics in dentistry.
Sure.
And that goes back to the materials that we use. The standby material from generations past, which was amalgam, is giving way to composites, and we also have ceramics that are replacing metals in dentistry.
Wow.
So we're getting things that are a lot more lifelike.
Sure.
They mimic tooth structure much more closely than anything we've had before.
Wow.
We can do dentistry